Welcome back to Cancer Buzz. I'm your host, Summer Johnson. It's Blood Cancer Awareness Month, and we're focusing on relapsed or refractory acute myeloid leukemia, or AML. Treating this aggressive form of leukemia has significant challenges. That's why it's important to bring new treatment options into routine oncology care, like menin inhibitors, so patients have access to novel therapies.
I've been doing hematology oncology for almost 30 years now. And, it's kind of wonderful at this point in our ability to treat any kind of patient, young or old, frail or fit, that we have so many treatment options that are available to us, oral and IV and all of those.
But how can we make sure that patients have access to these inhibitors, and how does this impact care? Joining us to answer that is Keri Halsema, a nurse practitioner. We started our conversation with a focus on involving patients and families.
Those are multiple conversations over, generally several clinic visits. We sit down and we talk to patients, and usually they have their families with them, about their overall diagnosis and what potential treatment plans are available for them. There's a lot of factors at play in these mutual decisions with respect to time commitment, financial situation, and those sorts of things. We are a center that draws lots of patients and families from sort of remote areas where they have to travel or even stay overnight in order to receive treatment at our facility. And so all of those factors come into play as well.
What are the main factors that are influencing the choice of treatment?
With respect to making decisions for any patient and their families regarding treatment, there's multiple factors involved: their underlying diagnosis, their overall performance status, where they live. Are they going to be needing to travel to our facility? Are they going to need to stay overnight? What kind of caregiver status? Do they have somebody that is willing and able and ready to provide care for this patient if they need that? Are we considering a chemotherapy regimen where the patient would need to be admitted to the hospital and in order for them to receive this chemotherapy? Those are all factors that go into deciding what the best treatment options are for these patients. And I guess the other thing that I'd like to say is I've been doing hematology oncology for almost 30 years now. And, it's kind of wonderful at this point in our ability to treat any kind of patient, young or old, frail or fit, that we have so many treatment options that are available to us, oral and IV and all of those. So it's just looking at historically what has been available for our patients. I think it's a blessing to have so many treatment options, and having to sit down with patients and families to actually discuss these multiple treatment options. On the flip side, this may be overwhelming for patients to make these sorts of decisions. I think as clinicians, we help guide them with respect to what we think would be the most effective upfront therapies for these patients, either, treating them as a newly diagnosed patient or with respect to treating their relapsed disease.
With which patient populations are we expecting menin inhibitors to have the greatest impact on? And how are those inhibitors changing your approach to treating relapsed or refractory AML?
So we as clinicians are really excited that we have another treatment choice with respect to targeted therapy in these patients that have either the KMT2A rearrangement or the NPN1 mutation, which feeds into that menin pathway that promotes leukemogenesis and the proliferation of these leukemic blasts. We're also involved in clinical trials at the University of Colorado, looking at both of these menin inhibitors in the newly diagnosed patient, as well as the relapsed refractory patient, in combination with other chemotherapy drugs. So, as an academic institution, we're always looking to offer clinical trials to the appropriate patient to further our knowledge with respect to the use of these medications and their effectiveness in treating AML.
What are some of the challenges and opportunities for improving patient access to novel therapies?
This is a big thing that, as a large academic center, kind of set in the middle of the part of the country where we're surrounded by lots of rural communities, and drawing patients from rather long distances, geographic distances to our facility. We talk about a lot because most of the patients that get taken care of here in the United States are actually provided care through community cancer centers. And getting the word out that these medications are available, they're accessible, with the right kind of training and knowledge. These medications can be managed pretty effectively at these community cancer centers, probably in partnership with an academic center to get these patients started on these medications. But having outreach and making sure that community oncologists are aware that these medications are available, that various academic centers have various clinical trials that patients may qualify for and may be enrolled in. That's something that's very important in moving care forward for these patients with AML.
Thank you, Keri. You can check out the show notes for more information about new treatment options like menin inhibitors, plus the latest research and treatment options for blood cancer. Until next time, on behalf of the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.